Congratulations on finishing your first week of the semester. You've done a great job, and I am looking forward to continuing to read your posts from the first week discussion. And I just wanted to kind of make some comments and wrap up week one as you dive into week two. So it has been fun to read your introductions. I posted one of my own just to participate in that. And I'm glad to know a little bit about you all and your backgrounds, both personally and in terms of where your practicums are, and some of the experience that you've had, professionally already, and where you're hoping to land in the field in the future. It is always interesting to see where we think we're going to go and where we actually end up, and I'll talk a little bit about my own process in those regards as well, because it does apply. It's applicable to this course. So week one, we talked about various approaches, learned a little bit about the DSM, the pros and the cons of the DSM, how it fits into the clinical world in the US, with a little bit of mention of different diagnostic approaches, internationally, although there is a lot of overlap between the DSM and the ICD, the international codes. Interestingly, though, when you bill insurance in this country, in private practice, you use ICD codes and not DSM codes. So, just note of interest. But I will continue to make my way through your discussion posts in terms of the approach to assessment that you thought would be helpful in terms of the fictional case, Miss Denise, that we looked at this week. I hope that in perusing each other's posts about the approach that you took, and I'm really, really, really glad to see that you're interacting on each other's posts. That'll make the semester much richer for you if you're, learning from each other. But I hope that you will take away from this the awareness that there's no one right approach or one right way to conceptualize a case. Some will fit better than others, obviously, in any given case. But they all can inform each other, and if we expand our views or our approaches beyond just one narrow way of looking at things, everybody benefits because we gain more information, we have more layers of understanding of somebody's circumstances, and we're more likely to get it right and not miss important factors just because we have this sort of narrow approach. So great job with that. I hear some of your posts resonating with each other, and other people bringing in other perspectives, and that's great. That's one of the benefits of this structured online learning format. So I am looking forward to this coming week where we're going to talk more about labels and stigma. This is a robust course. There's lots to do, so I would encourage you not to wait till the last minute, because you might find that there's more than you realize that you need to do in terms of the reading and the mini lectures that Dr. Mabry developed. It's a real robust course with lots of content in it. So hopefully you wouldn't have, it'll be interesting enough that it won't be too tough to keep up. I really liked that Graybiel article. So if you kind of had to skip out on some things this first week, I would really encourage you to go back and read the Graybiel article, because it really gives you a great overview of the way we approach diagnosis from a social work perspective, and it not just being a clinical assessment, but we're really trying to see more layers of the client and their experience and their world and their systems than just what we're going to get from the DSM. Okay, so stigma. Just a couple of thoughts as we dive into this next week. This is probably my personal favorite soapbox. One of them in the clinical world is the importance of combating stigma. As social workers, being social justice oriented, this is one of those areas, where we can make a real impact. when you think about, when you think about stigma, I see it a lot, specifically in my field, working in dialectical behavior therapy, which was initially developed for borderline personality disorder. DBT, dialectical behavior therapy, treats a lot more things than just borderline now, but it's still sort of the gold star treatment for borderline. And I don't know too many mental health diagnoses or people groups who have been more maligned in recent years than people with personality disorders. And so I have a lot of thoughts and a lot to say about that, and I'll save some of it for when we get there in the syllabus. That's quite a few weeks away. But, if one of the main takeaways that you get from this course is that having a mental illness or a diagnosis of a mental health concern doesn't determine who you are as a person, and that is not a moral failing, then you've gained probably the most important thing that you need to know. Of course, you need to understand the DSM. You need to understand various approaches to diagnosis. You need to understand how to sort through, make sense of symptoms, when it's appropriate to diagnose, when it's not. Do you give multiple diagnoses? Are you more conservative at diagnoses? There's all kinds of things that you need to wrestle through. And the practice with being able to do a thorough assessment, all of those things are skills that hopefully this course is going to really make a huge difference for you. But the way that you think about diagnoses and the way that you think about mental health challenges or mental illness or mental disorders, or the language that you use around it, is critical. It's really critical to the way that you walk through the world, both personally and professionally. And so my hope is that you will really wrestle with this idea of stigma, and the way that we as professionals so often feed into stigma. So anyway, I look forward to talking more about that with you all. Like I said, is my personal soapbox, especially when it comes to BPD, because that's the disorder that I have expertise in treating the most. And just a little commercial for a behavioral approach to that. And again, I'm sure I'll talk more about it when we get to the week of personality disorders. But even if you think you're a true blue psychoanalytic sort of, old object relations sort of person, that's great. I mean, it's a great way to think about things. It can really inform your creativity in terms of how you approach people's problems. But sometimes other approaches take the stigma out, where some of the traditional approaches leave it in. So when you look at something as a pattern of behaviors, that's different than saying somebody has a flaw in their wiring. So the language we use matters. And I hope that's one of your takeaways from even this first week of thinking, what's the difference between a mental illness and a mental disorder? What's the difference between, just some patterns that you're struggling with and a diagnostic label that sticks with you in your medical charts? All good questions to be asking. So if you have questions, just as I wrap up, questions about any of this stuff, feel free to reach out. I'm going to try to stay as active as I can in the discussion boards, and we'll just kind of see how the flow goes with this group over the course of the next couple of weeks. But shoot me an email directly at my UGA email, and I'm happy to answer any questions. If you're not getting the kind of feedback that you feel like you need, you can ask me that as well. I will do my best to keep up with feedback over the course of the next few weeks, and we'll see how it goes. So hope you all had a great week, and those of you who got snow enjoyed it and stayed warm. And I will see you in the next week. Bye.